Hi, today I'm going to talk about coding alcoholism. The definition of alcohol related disorders is when the patient may experience the need for daily intake of large amounts of alcohol in order to function, or the patient may have a regular pattern of drinking heavily on weekends with sobriety during the week, and this may suggest a pattern of abuse. There are a number of causes and incidents that may stem from biological, psychological, and sociocultural factors. For example, biological factors may include genetic or biochemical abnormalities, nutritional deficiencies, endocrine imbalances, and alcohol responses. Psychological factors may be the urge to binge drink or drink a lot of alcohol to help reduce anxiety or symptoms of mental illnesses. And sociocultural factors may include peer pressure or the patient having a stressful lifestyle and simply drinking to help cope with the stress. It is extremely important that the physician clearly documents the diagnosis for an alcohol related disorder. We as coders may look at the labs and see, hey, the patient's blood alcohol level is within the intoxication range, but we can't code it if it's not documented. This might be a good time to query the physician, as the diagnosis for an alcoholic related disorder, especially chronic alcohol abuse, may impact the risk adjustment factor. And we'll talk more about the risk adjustment factor in Medicare Advantage and future presentations. Chronic alcohol abuse may cause a number of complications, for example, malnutrition, cirrhosis of the liver, peripheral neuropathy, brain damage, and cardiomyopathy. Alcohol can damage body tissues by its direct irritating effects on the tissue, by changes that take place in the body while metabolizing the alcohol. Also, alcohol can aggravate existing diseases. It can interact between substances and drugs that are used to treat those existing chronic diseases and that are metabolizing within the body's tissues, possibly causing cardiopulmonary complications, GI, and hematologic complications, hepatic and neurologic complications, psychiatric complications, and other complications such as infertility and sexual dysfunction. The ICD 9 code book states that when coding from category 303, alcohol dependent syndrome, use an additional code to identify any associated conditions, for example, alcoholic psychosis, drug dependence, physical complications that may include pancreatitis, cirrhosis of the liver, gastritis, or hepatitis. Detoxification may be used to treat substance abuse or dependence. Detoxification involves evaluating the patient, observing the patient, and monitoring the patient. Um, Nutritional supplements such as multivitamins may be given to the patient to help with the detoxification process. And the patient may also, if substance abuse is involved, be given methadone to help treat the illness. Again, we're here talking about clinical documentation and just being sure, very clear, that the physician has documented an alcohol related disorder. Um, Although we can't code from the lab test, laboratory tests are useful in confirming alcohol use and complication. The blood alcohol levels can indicate intoxication. In severe cases of hepatic disease, the urine toxicology studies may help discover that the patient is abusing other drugs too. So we may find that we have to query the physician if you come across lab values and the documentation or the diagnosis that is documented by the physician doesn't support what we find in a lab value. Because once again, it may, if we're able to use the alcohol related disorder such as chronic alcoholism, it may in fact the risk adjustment factor. So the coding guidelines for category 290 through 319 and selecting the principal diagnosis is that if the admit is due to a condition unrelated to alcohol related disorders, we would code for the illness that was the physician documented. If the patient is pregnant, of course, pregnancy codes are sequenced first. The only exception here is if the doctor codes, or I'm sorry, if the doctor documents pregnancy as being incidental. Also, the alcohol related disorder is the principal diagnosis if there is not a substance related mental condition documented. Okay, so we find that the patient is suffering from, let's say, alcoholic psychosis. We would definitely code the alcoholic psychosis as the principal diagnosis, and then we would follow up with our secondary codes. Let's talk about a coding case study. Okay, we have a 49-year-old male admitted to the hospital with a chief complaint of stomach pain. He admits to the physician that he drinks heavily. He's been drinking heavily for the past week. However, there is no documentation of a history of alcoholic binges or alcoholic abuse. He was treated with IV fluids and pain medication. He was observed for possible withdrawal reactions and multiple vitamins were administered. The discharge diagnosis was acute pancreatitis. So we want to stop here, pause a minute. I want you guys to code this and come back and see if you share the same codes that I came up with. Okay, so my principal diagnosis was 577.0 acute pancreatitis. My second diagnosis was 305.00 alcohol abuse. And the principal procedure, the procedure code I was able to obtain was 94.62 alcohol detoxification. And the rationale is that the condition responsible for admission was the acute pancreatitis. We do not code the symptom of abdominal pain because the abdominal pain was due to the acute pancreatitis, and we don't code symptoms. We wouldn't code symptoms in this particular case. The code for alcohol abuse is used instead of alcohol intoxication in alcoholism because there is no history of alcoholism diagnosed by the physician. Now, I wouldn't be surprised that this patient did, in fact, have a history of alcoholism, but it wasn't documented. And in this case, I don't think I would even query the physician. I just don't think it would be important in this case. The observation for withdrawal and the administration of multiple vitamins are sufficient to code for detoxification. Thank you guys so much for viewing my presentation today on coding alcoholism. Please come back for future presentations. Feel free to contact me if you have any questions. I can be found on Facebook, and there's my Facebook link. I'm also on Twitter. Follow me on Twitter. Or you can simply email me at tjonesccsp@aol.com. And one last thing, please note that the information provided in this presentation are subject to change as coding guidelines are updated annually. They're updated October the 1st of every year. Once again, thank you guys for watching.